Assalamu alaikum. Good day to all of you, dear doctors. Today, I'd like to share a brief discussion about umbilical hernia. It is known to all of you that umbilical hernia is an abnormal bulging that can be seen or felt at the umbilicus. This hernia develops when a portion of lining of the abdomen, such as part of the intestine or fluid from the abdomen, comes through the muscle of the abdominal wall. Umbilical hernias are common, occurring in 10 to 20% of all children, but they are most common in African and Americans. Risk factors of umbilical hernias are low birth weight and premature infants are also more likely to have an umbilical hernia. Boys and girls are equally affected. Now, I'd like to share about the cause of umbilical hernias. As the fetus develops during pregnancy, there is a small opening in the abdominal muscle that allows the umbilical cord to pass through, connecting mother to body, connecting mother to baby. As the baby grows after birth, this opening in the abdominal muscle closes. Sometimes, however, these muscles do not meet and grow together completely, and a small opening remains. This opening is called an umbilical hernia. Here's the signs symptoms of umbilicus hernias are umbilicus hernias appear as a bulging or swelling in the umbilical area or belly button area. The swelling may become more noticeable when the baby cries and may become smaller or disappear when the baby is quiet. If a doctor gently push on the bulging when a child is lying down and calm, it will easily get smaller or go back into the abdomen. Sometimes the intestines get trapped within the umbilical hernia. This is referred to as an incarcerated hernia. When this occurs, the child usually has severe pain and the bulge may be firm and red. Urgent medical evaluation to exclude an incarcerated hernia is required in order to prevent possible damage to the intestines. It is uncommon for this to occur. Now here's the diagnosis of umbilical hernia is physical examination by a doctor can diagnose an umbilical hernia and can also determine if there are any abdominal contents caught in the hernia sac. Now I'm going to share about the treatment of umbilical hernia. This is so much important because uh, in the last exam, such as in May 2024, a question has came from these topics. Many umbilical hernias are closed shown thereon by age 3 to 4. If closure do not occur by this time, surgical repair is advised. In younger children, if there is an episode of incarceration or if the hernia is very large, surgical repair may be recommended. Surgery to repair the hernia is performed under general anesthesia. A small incision is made at the base of the belly button. If any intestine is present in the hernia, it is placed back into the abdominal cavity. The opening in the muscle is then repaired with multiple layers of stitches to prevent another hernia. A dressing and or incision glue is placed to keep the belly button flat. While premature infants and children with certain medical conditions may require overnight observation in the hospital, most children are able to return home within a few hours after surgery. In case of follow-up Long-term outlook is once the hernia is closed, it is unlikely that it will recur. However, the risk of recurrence is increased in patients who have wound infections following surgery. I think now I've got a brief overview about umbilical hernia. This is all about umbilical hernia. If any further questions, feel free to ask us. Okay. Thank you, dear doctors.